there's a greater appreciation now that when we talk about treating any complex diseases, that we need to get away from defining ourselves by the path of training that we took and really direct it towards the patient and the disease we're treating. It really doesn't matter whether an interventional radiologist, a vascular surgeon, a cardiothoracic surgeon, or a cardiologist. The more important focus is that we're all focused on taking care of that disease process. And so a meeting like this that brings a multidisciplinary group together that's really focused on the disease state allows us to focus on how better to take care of any individual patient. I think it's a wonderful idea for this meeting. It's too much to ask any one individual person to have the deepest knowledge base in every area and every perspective of how best to manage any individual patient. It really, I think, requires a multidisciplinary team to review those kind of complex cases together. And then to take it one step further, as we understand how to work together as people who have various skill sets, we need to work on how to train the people that are coming up after us to be better at collaborating. And we've learned that here in cardiothoracic surgery, as we've developed these integrated cardiothoracic surgery training programs, that if we can get our trainees exposed to cardiologists and cardiovascular disease earlier in their training versus the old conventional model where you do a whole bunch of general surgery before you finally get to the heart, that we're making a big impact on how people think about what they do, and we're getting them up to speed with kind of being better caregivers earlier in their careers. Roy came in as a guy who was a team player, a collaborator, a guy who thought sort of across arbitrary boundaries, like the diaphragm or this department or that. And so he fit in really well here. And we continue to build those kind of partnerships across lines. And I work every day alongside my vascular surgery colleagues and my structural heart cardiology colleagues. And so we have many multidisciplinary teams where we not only discuss individual patients to help make those decisions and make sure that we're guiding the best therapy for the best individual patient, but we even talk about other things like developing standardized protocols for imaging follow-up or workup processes, or even things like improving operative room efficiency and turnover time and sharing resources, which nowadays has become more important than ever.